Cancer. The word itself strikes fear into most people, and for good reason. In 2017 alone, it is projected that there will be 1,688,780 new cancer cases diagnosed and 600,920 cancer deaths in the U.S. But where did this deadly disease originate? The first descriptions of cancerous tumors date back to 1600 BC in ancient Egyptian writing. The ancient Greeks also looked into the causes of cancer. Hippocrates was the first to use the term carcinoma, and Galen, a Roman doctor, was the first to use the word sarcoma for fleshy tumors in the 2nd century. In 1800, Marie-Françoise Xavier Pichat was the first to propose that cancer was due to an overgrowth of cellular tissue. This was confirmed in 1830 with the discovery of the microscope and by cellular pathology work done by Rudolf Virchow. In the early 20th century, cancer was finally recognized as a notable problem for society. The American Society for the Control of Cancer, or ASCC, was founded in 1913, and the National Cancer Institute followed in 1937. ASCC became known as the American Cancer Society, or ACS, in 1945. Around this time, there was an effort to both educate the public on cancer and destigmatize the disease, as there was initially a lot of concern that cancer might be contagious. By 1970, cancer had become the 2nd leading cause of death in the United States, after intensive lobbying done by Mary Lasker, a New York philanthropist and volunteer leader of the ACS, and Senator Yarborough, whom explored the cancer issue with medical experts, business leaders, and cancer advocates. Richard Nixon declared war on cancer when he signed the National Cancer Act in 1971. The National Cancer Act was referred to as a turning point in the struggle to defeat this disease, and money and resources were allocated to fund research and help the translation of research to treatment. The governmental actions were directed through the National Cancer Institute, through the Public Health Service, and the National Institute of Health, or the NIH. Between the discoveries of the X-ray machine in 1896, the chemical structure of DNA in 1953, and the cure for choriocarcinoma in 1956, substantial progress was made in the diagnosis and treatment of various kinds of cancer. Scientists also recognized that defective genes that can lead to cancer could be inherited, and so early screening for at-risk individuals was key. While there is still a long way to go in the war against cancer, remarkable progress was made in the years following the 1971 National Cancer Act. As a gross average, cancer incidence rates and death rates have both declined towards the last years of the 20th century, while survival rates have increased markedly. Improvements in treatment, survival, and quality of life for people living with cancer have also been made. To quote Richard Klausner, former director of the National Cancer Institute, "We may not know how to cure cancer yet, but we do know what we need to do to get there, and that is very exciting." As we've discussed in class, there are many risk factors for cancer that are easily modifiable by lifestyle changes. If the war on cancer had focused equally as much on preventative measures as it did on research for treatment and a cure, do you think we would have less cancer cases today?